There are expressing concern, but the British government says it will not put new restrictions in place. Deepti Gurdasani is a public health researcher at the Queen Mary University of London. So the UK had been doing really well in lowering its number of COVID cases and deaths, but now the numbers are climbing. What's going on?
Well, the numbers have been steadily high actually over our summer. On the 19th of July, the day called Freedom Day, our government removed almost all mandatory restrictions within England except the need to isolate if you were infected. And that's meant that we've had continuously high cases between about 30,000 to 40,000 cases a day. And more recently, we've had cases rising even further since schools opened because of lack of safety measures in schools, and we're seeing rising case rates even in our elderly population, which unfortunately means more hospitalizations and deaths to come.
So I know mask wearing in general in the UK is lower than the rest of Europe. Is it time, do you think, to reinstate new measures?
Absolutely. I mean, we had the highest case rates and the highest death rates in the UK across all of Western Europe. And the reason for that is this premature removal of mitigations when a large proportion of our population wasn't fully vaccinated. And if we look at Western Europe, most countries have, basic measures like masks indoors, mitigations in schools. I think those basic measures being reinstated would really help us get on top of this because we're going into winter with record high case rates. We had almost 50,000 cases today, and our health services are already struggling, which is, of course, a signal of caution as we go into winter when things almost always get worse.